Dr. Jensi, can you able to hear me now?
Yes, sir. Yes, sir. Good morning, sir.
Good morning.
Morning, sir. Please be wait for 1 minute, sir. Our madam is waiting to welcome you, sir. Please. Madam will be in online within a minute, sir. Thank you.
Sure.
Hello.
Hello, ma'am.
Hello. Good morning, everybody. Dear research person, Dr. Sukumar Shanmugam. He is an assistant professor of Gulf Medical University. Thanks for accepting our invitation to go on with this webinar on clinical implications on dry needling in pain syndromes, chronic pain syndromes. Thank you, Dr. Sukumar, for accepting our invitation.
It's my pleasure, ma'am.
Okay, ma. Okay, very happy to have you back again after long years, I suppose.
Yeah.
Okay.
More than 20 years.
Okay. Very nice. Very nice. Okay, now he'll go on with the sessions. On behalf of Cheran College of Physiotherapy, I welcome him. Hope you all have a great time. Thank you all.
It's my pleasure.
You can continue. You can continue.
Yeah. Thank you, ma'am.
Thank you.
Good morning, all of you. As introduced by Dr. Silvarani Madam, he is my college senior and teacher. And I am very happy to share my thoughts and some of the whatever I learned from the last 25 years in physiotherapy and especially related to the pain management, I would like to share. And this is the small piece of knowledge from my side. And I would like to share the same to our physiotherapy students as well as the practitioners around the world, especially the students of Cheran College of Physiotherapy. And it's my immense pleasure to share my knowledge. And once again, thank you so much for Principal and Dr. Silvarani Madam and Professor Jensi for inviting me to give a talk on this particular topic. In fact, they asked me about what topic you would like to share with us. And just I told, since I am in the area of chronic pain syndrome researcher as well as the instructor for dry needling, so I thought of it's better to share my expertise field so that it is very important as well as it's perfect to share our own interesting field so that the students will be benefited as well as the practices will be benefited. Okay. As introduced by Dr. Sullivan, I'm Dr. Sukumar Shanmugam, and I have currently I'm working in as assistant professor in Gulf Medical University. And also I'm pursuing my postdoctoral fellowship from the Augusto Moto University Center, Brazil. And from last almost like 20 years, I'm practicing dry needling apart from the physical therapy practice. And I'm an eligible instructor for dry needling courses around the world. Okay, this is the brief introduction about me. Basically, I finished my bachelor degree from Ramakrishna Institute from Coimbatore. Masters I have done from Rajiv Gandhi University, Bangalore, and PhD done from my NITE University, Mangalore. Then after that, I moved to Gulf Medical University, the UAE. Okay, so the students and the participants and what we are going to learn about today's webinar. We are not going to cover entire things about the chronic pain. It is not possible to cover all the aspect of chronic pain. So whatever the things, what are the clinical implications related to the dry needling, or how the dry needling is going to helpful for the chronic pain syndromes. Okay, there are various chronic pain syndromes and we will discuss about that. And so we are restricted to this, how the dry needling can be very helpful for chronic pain syndromes. Okay, so what primarily we are going to discuss about, what are the key evidences, okay, of dry needling in for chronic pain, and we may quickly will discuss about the pathophysiology of chronic pain mechanism, and what are the mechanism related to the dry needling, which is how it is helping the reduction of chronic pain pathological process, as well as the therapeutic benefits are produced by dry needling. Okay, so these are the things we are going to discuss today's webinar. Somebody's mic is on. Please, can you able to just ask them to mute so that without any they can. Dr. Jency and somebody's, I think physio, somebody's mic is on. Ask them to unmute, please. Okay. So before getting into this, what are the evidences are available for dry needling in chronic pain management? Just I would like to just briefly discuss about what are the therapeutic benefits of dry needling. So dry needling, it is applied in the peripheral muscular level and also in the spinal level. Okay, so in the peripheral level and spinal and the central level, what are the therapeutic benefits can be achieved by dry needling? And these are the things. In the peripheral level, and it can increase the blood supply, and also it can leads to a healing of accelerate the healing of the peripheral tissues and reduce the nociception, and also it is very important in relaxing the muscle. In the spinal level, what it can do if you are performing dry needling at the peripheral level, or in case of peripheral level needling also, and it can reduce the neural irritation in the spine and the root level, as well as in the laminar level. And it can increase the widespread muscle relaxation whenever the needlings are done in the spinal level, and it can produce a segmental level muscle relaxation, and also it can produce the muscle relaxation related to the particular spinal segment, myotomes and dermatomes. Okay, and also it's reduced the laminar irritation. That's laminar irritation in the sense it is related to the tracts which is carrying the ascending information to the brain and brainstem and the other higher centers. Okay, that irritation also reduces according to the researchers, it says. Okay, in the central level, and it can modulate the pain through various substances release by opioid release and activating the descending pain inhibition. So these are the ways, and the therapeutic and benefits can be achieved by the dry needling in patients with peripheral pain as well as the central pain. Okay. All right, what are the possible mechanisms of dry needling? And anyway, we will discuss about this one, the latest part of this presentation. Just quickly, I want to give this some kind of orientation related to this, how the dry needling is effectively or favorably, it is reducing the pain and other benefits. So it can desensitize the spinal roots hypersensitivity, and it can sensitize the ascending tract irritability and desensitize the peripheral receptors. And also it can sometime in case of primarily in case of chronic pain syndromes or chronic injuries, and the dry needling can redo the healing process. That means reactivate the healing process whenever the healing process is reduced, and due to the lack of healing the inflammatory substances. And definitely this particular needling in the peripheral as well as the spinal level can induce the healing process. That's very important for the chronic pain management. And another thing is perceptual healing of the tissues. Perceptual, for example, if the dry needlings are penetrated in the peripheral level or the spinal level, that particular perception and perception is received by the higher centers that also can concentrate on the peripheral tissues, which will helpful for healing the tissues. And these points we'll discuss in the latter part of the slide elaborately. So just simply, we are not selecting dry needling as a therapeutic tool. Okay, because we are physical therapists, our dry needling is not a primary intervention for the physical therapist. In fact, this is the extra added. I mean, if any therapist, I think someone's mic is still it is on, and anyone just ask. Physio, somebody is there and his mic it's on still. And Dr. Jensi, just see that and ask him to mute, please.
Okay, sir. Okay, sir. I'll do the needful.
Yeah. Just see that the participants list. Yeah, participant list, and there one particular person and the organizer can mute them. I think I cannot able to do.
Yes, sir. Yes, sir. Yeah, I'm doing.
Yeah. Yeah. Good. Okay, so Dr. Jensi, is it audible?
Yes, sir. It is audible.
Yeah. Okay, right. So, so if you are selecting any treatment tool for your practice, always we have to think about the evidence. Okay, what is the available evidence for the particular treatment tool, whether it can be used by you or not. Okay. So dry needling is, as I said earlier, dry needling is not a part of physical therapy, and it is not most of the physical therapy curriculum. It is not including the dry needling in our bachelor level or the master level physical therapy program. But some universities in the United States, they have a dry needling separately in the curriculum, in the physical therapy curriculum. Within the physical therapy curriculum, they teach so that they will do without any legal obstacles. Okay, so but still around the world, physical therapists are allowed to do the dry needling procedures once if they are eligible to practice. Okay, so what are the evidences available for the dry needling in the clinical practice? And primarily the clinical evidence, that means what are the therapeutic benefits of dry needling? It is primarily depending on the skill of the therapist. Even though there are many therapists or the healthcare workers, they do this dry needling technique, but what is the benefit? The benefits are this is greatly achieved by the skilled therapist. If the diagnosis is proper and the selection of needling is correct, and definitely it can produce better results on the particular patients. Okay, otherwise, and it may be producing the what is that placebo effects. Okay, and what are the evidences? That means what in the literatures, when you are going to the literature search in your PubMed databases or Scopus databases or any databases, and we can find it is very beneficial for low back pain primarily when it's used in combination with other treatment, and it reduces the nociceptive input. That means pain production or the pain pathways can be modulated by dry needling, and normalize the synaptic efficacy and reduce the sensitization of the peripheral as well as the central neuron, which is related to the pain sensitization. And what are the evidences? Also, it shows that and dry needling can restore the muscle activation as well as the strength as well as the range of motion. So after dry needling, the range of motion, and in my practice, I have seen the range of motion is increase immediately in most of the patient, and in some patients, the range of motion will be improved after the 1 or 2 days. Okay, so definitely it has the evidence for reducing the pain as well as to improve the muscle activation as well as the strength. Okay, so it decreases the chronic pain of especially in the hemiplegic patients, especially neuropathic pain, and or in case of shoulder hand syndrome. And this is one of the treatment. It can be used as alternative therapy for to manage this particular hemiplegic patient pain. Okay, and and still the long-term benefits of dry needling is still it is under the what is that the debate. Okay, so still it is lacking for the long-term benefits, and surely it is producing all the evidences, the meta-analysis, randomized control trial, even the meta-analysis, what it suggests, dry needling, it is the best treatment for the short-term benefits, and for the long-term benefit, it is not superior to any other what is that your systemized physical therapy treatment program. Okay, so this is what the key evidences are available for the dry needling. Mr. Saktivel, your mic is.
Students, kindly mute your mic, please.
Yeah, okay.
Thank you.
So many students, I can see that many of the physiotherapy bachelor level students are attending this program, and they may be planning for the this particular technique in their future to use. Okay, and some of them they will be planning for going for the higher studies, and also for working for the different countries or in the Western countries. Okay, so when you're talking about the treatment which is not available within our curriculum means what you are studying in your physiotherapy in the bachelor level or the master level. Always we have to think that, and whether that particular treatment tool, whether it can be used by the physical therapist or not, whether we are eligible to perform this particular technique is very important one. Okay, when you see this, I'm taking the one country as an example, that is in the United States of America. Okay, in the United States of America, almost like around 50 states are available. Okay, so even the 50 states, almost like 36 states. Okay, the 36 states in the United States of America, and physiotherapists are eligible to practice dry needling. Okay, out of what do you mean 36 plus 8, it's a 44 plus, okay, almost like 50. So 50 states, 36 states, they are allowing the physical therapist to perform dry needling techniques. Legally, they can do it. And some states, around 6 states, and they are not allowing physical therapists to perform. Okay, so for each state, they have a different practice guidelines. Okay, so this California, New Jersey, Oregon, these are some Hawaii, New York, and Washington. These are the state they are not allowing physical therapists to perform the dry needling technique, because there only the acupuncturists or oriental medicine practitioners, they are eligible to do it. Okay, and some of the other 8 states, and still the physios are practicing, but they are not having any kind of guideline to whether to practice or not by the physical therapist. They are still, so almost like what we can see in the your right side the screen here, is the law prohibits PTs from performing dry needling, and California, Hawaii, New Jersey, and New York, Oregon, and Washington. These are the states, and they will not be able to, physios are not allowed to do the practice. So if the students are thinking about going to these states and getting certification from various dry needling course organizers, and I will suggest not to do it. Or if you want to practice in India or practice in any other Western countries, and definitely you are eligible to, you can get the certification courses and you can practice it. So this is why I am showing this slide. Always make sure that whenever you are learning one new technique, you have to see that that particular technique is within the physical therapy practice of a particular state or the particular country. Okay, so as per that, you can you can go for the any value-added courses certifications. You can see some students. Mr. Tamilarasan, and your mic is on.
Students, mute your mic, please.
And if you have any doubts, you can ask. We will be having this discussion session. That time you can ask the questions.
Students, please mute your mic, okay?
Okay, right. Thank you. Okay, right. So, what is the importance of knowing about the eligibility of physiotherapist to perform dry needling? Just one glance. This is only related to the US, but still in India, I don't know. We don't have that proper guidelines. Okay, but still, almost in all the states in in India, we are practicing. All physios are practicing. Most of them they are practicing dry needling. Okay, in their private clinics as well as some of the hospitals. Okay, but what is the recent council for the healthcare professional? We don't know whether this particular needling can be performed by the physical therapist in India. We have to check it whether it is coming under our practice guidelines. Okay, so now we'll jump into the pain. So with most of them, they know, everybody knows about if there is any injury to the peripheral structures, definitely the nociceptor will be activated by different nociceptive substances, and that will carry the impulses to the spinal cord. From the spinal cord, it reaches the midbrain as well as the heights in the cerebral cortex. Okay, and for each pain impulses, and the individual person will react in different way. Okay, some may tolerate, they have a well pain tolerance, and some may have very weak pain tolerance. Okay, this everything depending on the complex interaction of the autonomic, peripheral, and central nervous system, as well as the endocrine and immune system. So all this complex interaction between these systems, and it will decide the person's pain sensitivity. Okay, so some are having very high I think Jency, what we can do is from the organizer side, you can mute all the student mic. Mr. Sagir, your mic is on, please. You just mute.
Students. One, kindly mute your mic, please.
I think Dr. Jency, and from organizer side, and we have option to mute the.
Yes, sir. I'm doing, sir. I'm doing.
Let's do that. So
yeah, please.
Yeah.
It is a lovely tree. Thank you for carrying it all the way home.
You're most welcome. Let's get it different. Emma puts the glitter on the tree.
It's so
George hangs the ball. Mummy Pig fixes the pen. And Annie runs off the very top of the tree.
Mr. Sagiruddin, I think he's just he left, I think. Yeah. Is it muted?
Yes, sir. Yes, sir.
Yeah. Okay, fine.
Yeah,
right.
please, sir. Thank you.
Okay, it's fine. So what happened here if the injured area is not treated, okay, or the pain nociceptive stimulation is persistent or continuous, and it can sensitize the receptors or the receptors in the peripheral and pain receptors or the pain pathways in the spinal cord, and also the pain centers in the central nervous system. Okay, so always we have to know that, okay, we should know what are the factors which is associated to the pain and which are the aggravating factors, and that has to be managed immediately so that the sensitization will not be reached, okay, in the higher level. So what is important is here, any persistent pain or pain production or the pain in stimulation, and definitely that can sensitize the pain receptors, okay, peripheral or the central nervous system, sensitization will take place. So once it is the systems are sensitized, or the neurons are sensitized, and definitely then we have a higher role to work on that, and also sometime, and the pain management will be a very tough task for us as a physical therapist or any healthcare professional to manage it. So we have to prevent the neuronal structures getting sensitized, okay. And also in case of most of the chronic pain conditions, and there are several chemical processes are taking place, and those chemical processes can lead to the cerebral disorganization, and also it produces the pathophysiological changes in the neurons, okay. That's all the neuropathological process in the peripheral as well as the central nervous system, and that can lead to the hyper-excitable neuronal state of the pain receptor as well as the pain fibers in the periphery, and also pain tracts in the spinal cord as well as the pain centers in the cerebral cortex as well as the midbrain, okay, and other structures also. So the hyper-excitable state, once it is reached, and the patients will start complaining the exaggerated or the hypersensitive state of the pain perception. So again, if you are managing this chronic pain symptoms in the acute stage itself, definitely we can prevent the several pathological process related to the chronic pain syndromes. Okay, so always when the transition of acute pain to the chronic, That is, in fact, we have to stop this process. But if it is happening, the acute to the chronic pain, and that can be minimized by the early recognition of the risk factors and the early biophysical pain management method. Okay, so just by applying any one electrical modality or exercise, any manipulation techniques is not going to be 100% helpful for the chronic pain patients. Okay, so always we have to look into the physical and also mental as well as other issues related to the pain. Okay, so we have to work on the behavioral modification, we have to work on the what is the psychological aspect of the patient, and also we have to work on the treating the pain in the peripheral level as well as the central level. So these are the things important for us to manage the chronic pain syndromes. So what exactly is happening in case of chronic pain syndrome? Just a minute. Okay, right. So what do you mean by chronic pain syndromes here? And in case of chronic pain syndrome, what is happening here? Persistent peripheral nociceptor firing will be there. Sympathetic activation and energy crisis and failure of healing after the injury, and neuropathic substances release and peripheral and the central sensitization. So these are the primary mechanism which is related to the chronic pain. What is the process is taking place? Okay, so what exactly is happening? Central sensitization. Okay, central sensitization. What do you mean by central sensitization? The pain fibers or the pain, the neurons related to the pain, that will be sensitized. That means the hyperexcitable state. Okay, that leads to the reduced pain, pressure pain sensation, and patient pain threshold, and hyperalgesia, hypersensitivity, and fear of performing any movement, and reduced quality of life. So the next slide will explain and very elaborately or schematically, and how chronic pain can be manifested in the patients, those who are developed injuries in the previous time. Okay, so what exactly is happening in case of chronic pain? It's a sensitization effects. So whenever the peripheral receptors, peripheral nerves, and the posterior root ganglions or the posterior neurons are sensitized, and also central nervous system neurons sensitized. So this, when you see the bottom of the line, the bottom of this graph or the schematic, this diagram, we can see that once the particular injury develops to the peripheral, just take it one particular area is injured. Okay, initially the patient will complain of localized pain. Okay, that is because of the release of certain substances, like for example, histamine is released immediately. So that will stimulate the receptors, that is A delta C fiber. The patient will complain of pain. Then that will be subsided when you are just normally also, and also whenever taking pain medications or any other treatment, that will reduce. Okay, in some time, that particular substances which is responsible for the pain, the acute pain, okay, that will not released, or that will not be resolved from that particular place. So in that case, continuously it will start stimulating the peripheral nerve, and that will release several neurotransmitters, which is the substances which can produce the pathological process related to the pain fibers which is attached or related to the particular injured area. Okay, that can leads to the peripheral sensitization, that can go to the peripheral sensitization. Okay, and also the autonomic nervous system will be sensitized whenever the particular person is continuously and perceiving the pain. Okay, because all motor as well as sensory nervous systems are connected to the autonomic nervous system. So when the autonomic nervous system, autonomic ganglions are affected, or it is sensitized, and it can start producing the referred pain. Okay, so if the continue this pathological process, it is not resolved, it is keep on continues, then and it can go for the several changes in the spine posterior root ganglion. Okay, that can produce a spinal segmental sensitization, and that can lead to the radiating on the referred pain. And also the spinal lamina, that's the tracts, also will be sensitized because of several substances which can irritate the what is the lamina, that is the tracts of the spinal cord, especially the spinothalamic tract, as well as the other ascending tracts which is related to the nearby the what is it, your spinothalamic tract. So that can lead to the trough edema and the hypersensitivity of the particular for the widespread trough edema as well as the hypersensitivity in the particular patients. So this process, it's keep on progress, and it can sensitize the central nervous system like midbrain in the periaqueductal area of gray matter, the midbrain, and also in the what is it cerebral cortex. So that can lead to the allodynia and also the supersensitivity, and all together, and it can do the several changes in the particular patient's behavior, and it can produce a fatigue syndrome, and also it can reduce the quality of life. So this particular chronic pain tree will explain to you how, if you are not treated the acute injury to the area properly or inadequately treated, and that is the primary cause for the patient to develop chronic pain syndrome. So if you are treating in the peripheral level, whenever the localized pains are available, and if you are treated effectively by the appropriate treatment, and definitely we can stop these pathological processes are taking place in the particular patient. Okay, so this will be very helpful to understand how the peripheral pain will be converted into the central pain. Okay, so now what are the common chronic pain syndromes? And most of them we know about the shoulder pain, neck pain, back pain, and tension type headache, myofascial pain syndrome, and fibromyalgia. So it is not like that I'm taking only these these 5 conditions. These 5 conditions is an example for the chronic pain. Okay, so we'll be discussing about what are the recent studies it is explaining, or what the information it is giving for us about the effect of drilling on these particular conditions: fibromyalgia, chronic shoulder pain, chronic neck and back pain, and chronic tension type headache, and myofascial pain syndromes. Okay, so let's see how this particular dry needling technique is useful for these particular conditions. Let's see here. This is one of the recent study. It is published in the 2018. This particular study, and what they exactly they have done, and they studied the dry needling versus myofascial release. So they compared these 2 techniques on 62 patients. Okay, in the 62 patients, they divided the patients into 2 groups, like dry needling group as well as a myofascial, that's a manual release, myofascial release. Okay, so what exactly they found it? They found it on the pain pressure threshold, quality of life, fatigue, pain intensity, quality of sleep, anxiety, depression. These are the outcomes, and they have measured, and the before and after these particular 2 different types of treatment. Okay, one group dry needling, another group is myofascial release. So what exactly they found it? The dry needling reduces myofascial trigger point pain in the short term in patients with fibromyalgia syndrome. In short term, as I said earlier, primarily this dry needling work for excellently in the short term, not for the long term. In the long term, in case of it is not showing any kind of added effects. Okay, that's what again this particular study also will explaining to us. So the next one is improve the anxiety, depression, fatigue syndrome, and quality of life and sleep after that. So whatever the outcome they got it for these outcome measures, and dry needling groups was better than the manual myofascial release. Okay, that means fibromyalgia, it is one of the common, chronic pain syndrome. So dry needling is producing a better treatment effect than the manual myofascial release. Okay, this is between only these two. Okay, we are not dry needling is not dry needling versus any other treatment, only between these two. Okay, maybe for other treatment, maybe some other standardized physical therapy treatment, maybe it's better than the dry needling. But in this particular study, what they studied only compared these two particular treatment. Okay, so what the third point, that third conclusion they arrived, decrease the intensity of pain and impact of the fibromyalgia symptoms. So definitely pain intensity and the impact, those also will be reduced in case of, it is better reduction in dry needling group compared to the myofascial release. And what they're suggesting is this particular authors consider in an independent manner as a complementary therapist within the multidisciplinary setting. So whenever you are using this particular treatment, and this is one of the treatment technique which can be applied in combination with other treatment in the multidisciplinary setting. That's what they were given the information from this particular article. So what this article says, what are the clinical implications we are taking from this particular study? Okay, definitely dry needling is one of the treatment tool for treating the fibromyalgia patients. Okay, so what is the next study? Dry needling has lasting effect, analgesic effect in shoulder pain. It's a double-blinded study. In this particular study, what they found it. In the 41 patients, they divided into two groups, 20 groups for dry needling and 21 patients for the sham needling. Sham needling means that's like needle. It's not a deep needling. It's like they keep the needle in only in the subcutaneous tissue. Okay, so that's called a sham needling. That's called, like we can see the duplicate needling. Okay, so what this particular study, they found it for the chronic shoulder pain, dry needling lead to the significant larger pain intensity reduction. Okay, and also what we can see, the number of trigger points, so this definitely the pain reduction scores were significantly different on the second day after the needling and persisted, and so until the 7th day, and were accompanied by improvement in other dimensions of pain and decrease in the area of mechanical hyperalgesia in the active dry needling group alone. So in the dry needling group, definitely the pain related or pain associated outcomes, definitely it is better in dry needling group compared to the sham needling. Okay, so the active trigger points, the dry needling provided analgesic effect compared to the sham and decreased the area of local mechanical hyperalgesia. This is very important. The local mechanical hyperalgesia is one of the initial stages of your chronic pain syndrome. So the mechanical hyperalgesia is reduced in case of dry needling when it is compared to the sham needling. This is another evidence for how dry needling can be a better treatment tool compared to the sham needling. So this is for this is one of the highest meta-analysis study. Okay, that is study is recently published, and they compared the effectiveness of botulinum toxin injection with some other treatment, like even dry needling. Dry needling also they have taken as one of the comparative treatment for botulinum toxin injection. Why I have taken this particular technique? So botulinum toxin is one of the injection therapy, and we cannot do it, and only the physicians or the neurologists, they do it. Botulinum toxin injection is a drug which will be injected into the trigger points or there's some painful areas, and that will be blocking the pain inflammations. Okay, so they compared this whether this dry needling without any medications and botulism toxin injection, whether the treatments are, whether if there is any added effect of botulism toxin to the dry needling. So what they found it here, and they have almost like more than 100 articles they have selected for this review. Then finally they selected only 9 RCT, randomized controlled trial, with a comprising of 666 patients. Okay, they have divided the groups into one group with the shoulder joint pain and another group with the shoulder myofascial pain. Okay, this many patients are where they were evaluated. The effectiveness of botulism toxin injection did not differ from the reference treatment and saline injection and versus dry needling. So dry needling or saline injection or any other reference treatments like some other treatment. Okay, so what they found it, there is no difference in the treatment effects between the botulism toxin injection and the dry needling. So what this particular studies, this meta-analysis indicates that, so irrespective of whether the drugs are injected or drugs are not injected in case of dry needling, so there is no much difference. There is no difference between these two type of technique. So what it's important for us as a physical therapist, where we are not supposed to do the injection, if there is any drugs injection to the patient, so we can use dry needling as a better treatment tool, which is also producing the effective pain reduction as like in botulism toxin. So no need to go for the any kind of injection therapies, and you can select your dry needling technique if you are eligible, and definitely you can produce a better treatment effect on this particular patient, shoulder pain or the shoulder myofascial pain in the chronic pain syndromes. So that's why I have taken this study to show to you all, so that you will have a better understanding how the dry needling is without any medication, how it is producing the effects. Then another one, what is that? It's important one. Dry needling combined with the guideline-based physical therapy provides no added effect or benefit in the management of chronic neck pain. So this is very important one. Why it is important one? The previous studies what I have discussed here, one was dry needling with sham needling, dry needling with what is that? You have a myofascial release, and another one is dry needling versus botulism toxin injection. But here they compared, that is also in the recent 2020 release study, they compared the effect, the added effect of dry needling. There are two groups. One group received dry needling combined with guideline based, that means evidence based physical therapy. Another one is only guideline based physical therapy. That means in one group they are given the dry needling, it was added. Another one is without dry needling. So what this particular study is concluded, when combined with guideline-based physical therapy for neck pain, dry needling resulted in the small improvement in pain only in 1 month post-intervention or post-randomization, we can say. There was no effect on disability. So definitely, and whenever you are selecting the guidance, that is guidelines or the evidence-based physical therapy program, that is sufficient enough to produce a good clinical outcome on pain as well as on disability. Okay, that's what this particular study says. So what it is not like whether all the chronic pain syndromes or all the pain syndromes need dry needling. Exactly, no, not required. Every patient not required to treat with dry needling. So if you are giving the guidelines or evidence-based physical therapy program, it may be a mobilization or any other manual therapies or electrotherapy modalities. If it is evidence-based, if you are selecting this correct, appropriate evidence-based physical therapy program to the patient, definitely that will be giving better benefit in those patients. Definitely not required to treat the patient with dry needling. Okay, this is very important for the physical therapy perspective. Okay, so why I am saying this one here to you all, and every patient don't select dry needling. If it is only required, you have to select, otherwise not required. And if you are selecting evidence-based physical therapy, and that is only sufficient to produce a good clinical outcome on the patient. Okay, so don't run behind dry needling every time. Then another one is, this is a very common one, trigger point dry needling versus sham needling. Already we have chronic tension type headache. So in this chronic tension type headache, and I think since the students are in the UG level, and most of them they are UG level, and we have a treatment manual therapy techniques. Cervical mobilizations will be useful for your chronic tension type headache to reduce the headache. Okay, so for dry needling, what it's exactly doing in case of chronic tension type headache, definitely it is producing better result. And I have treated some cases, and definitely it is producing a better treatment effect compared to the other manual techniques. So what this particular study says, the result of this clinical trial suggests that trigger point dry needling in patients with chronic tension type headache is effective and safe in reducing headache intensity, frequency, duration, and increasing health-related quality of life compared to this, what is that, sham needling. So definitely you can select it. If anybody is having tension type headache, you can, if you are eligible to do this procedure, definitely you can go for it. So these are the articles just I wanted to show to you all how dry needling is improving, or how it is beneficial for treating chronic pain syndromes. So now you might get some kind of idea. So when you can use dry needling, when you no need to use dry needling. Whenever using the very simple techniques without any evidence-based techniques, if you are treating the patient, and you can go for the dry needling as a treatment tool. Whenever you are selecting this one, guideline-based physical therapy program or physical therapy treatment, definitely that is only sufficient to treat the patients. Okay. Okay, so what are the areas can be needled? These are the things I have seen some of the some instructors, they do the needling to the nerves, and it's very needless one. If anybody is doing needling to the nerves, it's not at all recommended. Okay, so what are the areas you can needle? Myofascial pain, that's the trigger points, muscle knots, and any kind of hyper irritable spots, tension points, and post-injury scarring. Scar tissue mobilization, you can use scar tissues area, you can needle in ligaments, you can use it, and tendons, you can use it. Okay, and this also, other than the nerve, other than the smooth muscles. Okay, so definitely you should avoid nerves or the vital organs. So only these areas you can needle. Muscle you can needle, ligaments you can needle. Okay, there is scar tissue you can needle, and tendons you can needle. Nothing wrong in that. But the only thing is you have to see that precautions and the contraindications. So these are the primary contraindications for dry needling. If you are selecting dry needling as a treatment tool, malignancy, that means a tumor, spreading tumors. The spreading tumors always you should avoid in those patients. And open wounds, over the open wounds, you are not supposed to do it. Severe arteriosclerosis, and you're supposed to avoid. Aneurysm, if there is found, you have to avoid. Specific sensory neuropathies, like in case of sensory losses, and better to avoid the particular area. And advanced osteoporosis, and that you can vigorous needling has to be avoided. In case of this is absolute contraindication, but advanced osteoporosis, that's the relative contraindications. And the pregnancy, you are not supposed to, especially in the first trimester. And if your patient is in the first trimester, definitely you should avoid, and there is a possibility of abortion. And you should not needle the area of pacemakers and confused patients and needle phobia, and definitely you are not supposed to treat the patients. Bleeding disorders and if the patient is having anticoagulant therapy, you are not supposed to do it. And prohibited areas like nipple, umbilicus, and external genitalia, and these areas you are not supposed to treat by dry needling. Okay, so there are several complications also it will be developed, and these complications can be avoided. It can be avoided if you are taking the correct precautions and correct needling technique. If you select, definitely you can avoid these particular the complications like persistent pain, hematoma, fainting, stuck needle, broken needle, infections, fatigue, and pneumothorax is one of the very common. Okay, so this complication definitely you can avoid it if you are selecting the correct treatment by using the. Okay, right. So these are the things, and I would like to just, I'm coming to this particular slide. Okay, where we can needle in case of chronic pain, where we can use the needle in case of chronic pain syndrome, and which area you are supposed to needle, which area you are supposed to needle. I'm coming to this. So in case of chronic pain, the sensitization of the spinal segmental neurons and sensitization of the midbrain neurons and sensitization of what is that in the central nervous system neurons. Okay, so whenever the sensitization takes place in case of chronic pain, where you are supposed to needle, the needling can be done the peripheral level. That means in the wherever the patient complains of pain, and you will do the needling. But in case of chronic pain, the patient will having widespread pain, and you will be confused where to needle. So what is the solution? So always you will be selecting the spinal level needling. Spinal level, that is a paraspinal level, you will be needling the area, so that whatever the segment, the spinal segment, which is supplying the dermatome as well as the myotome, the myotomal structures, the dermatomal structures be related to the that particular spinal segment. If you are needling over there, and it can relaxes the muscle of the particular spinal segment, and also it can reduce the irritability of the tract which is originating from there. So whenever the patient complains of widespread pain, any kind of chronic pain syndromes, and it's better to needle in the paraspinal level instead of the peripheral level. So that will produce widespread relaxation of the muscle and widespread desensitization of the sensory receptors in the periphery. Okay, so the always recommended, it is recommended to perform the paraspinal needling to desensitize the spinal nerve roots and desensitize the ascending tract irritability. And also we can reduce that if needed, and you can select the peripheral level needling. So after needling done in the paraspinal level, okay, most of the pain symptoms reduces. Okay, and some areas will be expressing their pain perception in certain areas. So in those particular certain areas will be the causative factor for the particular chronic pain syndrome. Then you can select that particular area for peripheral needling. So then that particular peripheral tissue which is not healed completely, that can be the new neovascularization or the new inflammatory process will be developed by the needling process. That needling will take care of the increasing the blood supply to the peripheral area, which is originally is injured. Okay, that can be needle, improve the blood supply and induce a new healing process, and also to reduce the pain substances which is accumulated over the particular peripheral area. So the chronic pain completely can be reduced in most of the cases. Okay, so my request or my recommendation, always you don't go for the dry needling as a primary intervention, or in case of you are using a primary intervention also, always go along with your manual therapies. So manual therapies and dry needling on any other electrotherapy modalities has to be combined with dry needling. Then only you may get that better treatment outcome than when you are alone, your standalone treatment of dry needling or standalone treatment of any less evidence-based treatment, it will not work. So once you go for the evidence-based physical therapy treatment, or you go along with the dry needling, along with the some other treatment techniques or manual therapies or the electrotherapy modalities. Okay, so this is the information I would like to give today. And since the most of the participants are the UG level student, I didn't go, it's much beyond that level. Okay, so whenever the patient is having chronic pain, the sensitivity has to be reduced. How to reduce the sensitivity? You reduce by using dry needling means you have to go for the paraspinal dry needling. That will reduce the widespread pain areas, pain perception for the patient. Okay, once the widespread pain reduces, the actual pathology in the periphery can be identified. Okay, that will be needle with the peripheral needling to improve the circulation, to improve the inflammation, which is important for the healing. The healing process will be you are redoing the reactivating the failed healing process. That will take care of the remaining process of pain reduction. Okay, both all enkephalin release, endorphin release, and those all will take care of the pain reduction or the pain relief. Okay, and thank you so much for your listening. And if you have any questions, and you can ask, you can write in the chat box, or you can send the question to Dr. Jensi, then I can answer for that.
Students, if you have any questions, you can ask now, please.
Especially master student, anybody is there, and if you have any doubts in the clinical application of dry needling in chronic pain syndromes, you can ask, please, so that I can explain.
Master students also there, sir.
Yeah. If anyone has any doubts, they can ask, please.
The PG students, you can ask questions.
Any other? I think, yeah. You can unmute your video so that I can see you. Mr. Varun Kumar.
It's not so that.
Hi.
Hi.
Yes, Varun, just please.
So you said about the dry needling and chronic pain management, sir.
Yeah.
So is there any we can apply dry needling to reduce the spasticity of the muscle?
Yeah. Okay. That's one of the study I was shown that in case of spasticity, it is a central phenomena, right? It's a central phenomena. Spasticity is central phenomena. But dry needling, there are some articles. I have read some 2-3 articles. It is published on how dry needling into the spastic muscles reduce the spasticity, and how it is working for the coordination between the spastic and the non-spastic muscles. That is a coordination of the movement. Okay, So what they are needling to the spastic area, spastic muscles. They found that what is the temporary reduction in the spasticity, and also, and it can normalize the muscle coordination, the agonistic and antagonistic muscle coordinations, and during the short term, and it is helpful. Okay, it is helpful for improving the coordination between the spastic muscle and non-spastic muscle after the needling, and definitely the spasticity grades is reduced, but it is stay for it's only the short term. Maybe it's applicable for with only for few days. Only the short term benefits are available for spastic reduction, not for the long term benefits. You can use, but personally, according to my practice on dry needling related to the spasticity, and I have used this technique for in some kind of CP patient, that is adult CP patients, and it is immediately the muscle tone reduces. We can stretch it easily, the spastic muscle, if in case of deformed muscle also. But it is only stay for only temporary. It's not long-term benefits we are not getting. So better you go for the task-oriented approach, any other manual therapies or neurotherapeutic techniques. That will be a better option. In case of severe spasticity is not at all reducing, you can try. You can try with the dry needling to the spastic muscle area, especially the motor point area. You can just needle around that, and it will be helpful if you are practicing dry needling. Yeah. You got it? You got my point, or Varun, Dr. Varun?
Thank you, sir.
Oh, okay.
Students,
Anybody?
any other questions?
I think all are in, they got tired, I think, listening. Okay, thank you so much.
No, sir. In chat, one student asked a question.
Okay, I will check. Excellent question. For diabetic neuropathic pain, we can use or not? And who is that? Parvati. Definitely, it's not recommended. Definitely, it is not recommended for to use dry needling for diabetic neuropathic pain. Okay, and in fact, we can see it is like it's a what is it? Contraindication. Diabetic neuropathy, it's a contraindication for dry needling one. It's better not to use. Some of the acupuncture treatments are there. They do the superficial needling. Okay, only they do in the superficial area. They only in the subcutaneous tissue level. And that may improve some kind of vascularization, increase the vascularity to the superficial areas. But deep dry needling, definitely you should avoid in case of diabetic neuropathic pain, because diabetic neuropathic pain also one of the chronic pain in the later stages. Okay, so it's a contraindication, Dr. Parvati. For deep dry needling, superficial needling you can do it, but I have not done it. Usually, whenever the diabetic neuropathy comes, we avoid. You go for the aerobic exercise and other physical therapy program for diabetic neuropathy. Parvati, I think you got my point. Okay, right. Or diabetic. Anybody is having medication like then anticoagulation medicine, and those patients having anticoagulation medicine, and you are not supposed to do it. Okay, anybody is having blood thinner, they are using blood thinners, definitely we are not going to use, especially the deep dry needling that can cause more bleeding. So better not to use. Difference between acupuncture and dry needling. Dry needling, it's very, very specific to the certain, only the muscles and the certain ligaments we are doing it. In case of acupuncture, and they do the systematically, even for the various systemic illnesses, even diabetes mellitus, as I said earlier, diabetes or various internal organal issues also, systemic disease also they use it. Okay, that is a vast field, and dry needling is very specific to the musculoskeletal, neuromusculoskeletal structures, and we are producing the neural modulation. Okay, and we are, in case of dry needling, we are, the dry needling points are not pre-specified. Pre-specified means, okay, if I want to, if there is any pain in the neck, I will examine that area and I will decide which area has to be needled, which is a problematic area, we will be needling over there to produce a clinical outcome. But in case of acupuncture, for example, in case of cervical spondylosis, they have a pre-specified needling areas. From the top to bottom, they use the that's called as what is acupuncture points. So the acupuncture point level only they do the needling. But in case of dry needling, it is not like that. Where is the problem, and you will be striking over there to produce a effect. That's all. Okay, but acupuncture is different philosophy, and dry needling is a different philosophy. Yeah. Good question.
Students, any other questions, pa?
Okay, one more questions. While practicing, usually patients confuses this treatment with acupuncture. Have you faced problem? Yeah. Okay. So acupuncture, whenever the patients are coming to you, and they will, I will examine the patient, and if dry needling is required, then I will take it. Otherwise, I'll go for the standardized physical therapy treatment. Physiotherapy treatment is far better for most of the conditions. Okay, but in case of very deeper structures, for example, in case of multifidi muscle, okay, multifidi, or in case of piriformis muscle, the deeper muscles, if I'm not able to manipulate, okay, so I may select this particular treatment technique called dry needling, and I will be explaining to the patient. There are one option. This is the dry needling, and they will ask immediately, this acupuncture, yeah, the needles are acupuncture needles, but the techniques are different. I will say they will ask, definitely they will ask, because most of the time the patients are always, they will ask many questions to you. So you should give the reliable information, the correct information to the what you are going to do, what is your objective. Only you have to speak on that. Okay, so definitely they will ask. Many patients, they asked me whether it is acupuncture and dry needling same or not. In fact, the needles are same, but the philosophy, the techniques are different. Yeah. Good. I think the question was asked by Mageshwari. Thank you, Mageshwari. I think
any other questions, students?
Yeah, one more question is there. I don't know the name here. Which is the better treatment for fibromyalgia? Who is suffering from severe pain in multiple places? That's why this particular if you are dry needling practitioners, definitely you can use dry needling as weekly one session, combined with your aerobic exercises or behavioral modifications. That is the best combination of treatment. Okay, dry needling alone, it is not going to produce much effect. Definitely it's producing the effect, but for the quicker recovery, and you should go for the multi disciplinary approach is better for fibromyalgia patient than only by dry needling. Only dry needling, it is not recommended according to me. Okay. Yeah, these are the questions were there. Yeah, it was a good student, good questions from the most of the students. That's good. Okay, but and all the best for as a student. Definitely, you just nowadays you are getting lots of information from the internet, and definitely you have the good scope for identifying which is a better treatment. So every week you can go and search in the PubMed and other databases. There are good treatment protocols are published. Okay, definitely you can use this protocol for your patients, for your studies. That will help you. That will be very helpful for you people for during your examination as well as for your practice after your bachelor degree or the master degree. Yeah.
And
Okay.
okay. This is the time for thanks for everybody. So first of all, I should take this opportunity to thank Dr. Sugumar Shanmugam, and he's a resource person, and he's a senior for me, and he's a junior for our Selvarani ma'am, our principal ma'am. And once again, we are thanking for this presentation on behalf of our college and on behalf of our Selvarani ma'am and staff and students. And once again, I'll take this opportunity to thank all the students, those who are sitting for 1 hour and listening the academic patiently. Okay. Thank you for your cooperation also. Okay. Thank you, sir.
Thank you so much. And it's my pleasure to have a presentation, this presentation today.
Welcome, madam. Welcome, madam. Thank you, sir.
Thank you. Thank you. How are you?
Fine, 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 sir. Fine.
It's okay. Very nice. Very nice to have a talk today. Okay.
No problem, sir.
Okay. Okay, sir. Thank you so much for all
It was very informative class, sir. It was very informative class.
Yeah, in fact, just a very small information I had given because I don't know exactly what type of population they are going to come today. That's why I keep it very simple and very less information. And if in case of PG students or the practitioners, and it is required some more points to have a better understanding about this concept. Okay, in the future we'll see that, and when I'm coming to India, and maybe and face to face will be better for everyone to understand better. Okay, let's see that.
Definitely, we'll use this. Yeah, definitely we'll use this opportunity, sir. We'll inform our ma'am, and we'll try to have a direct presentation also. So once again, sure. I'll take this opportunity to thank you once again, sir. Thank you.
Thank you, all of you.
Thank you. Thank you. Thank you, sir. Thank you so much.